Good afternoon, Your Excellency, Chairperson and UN Council. We are the e-wasters and we are having a project on intervention to mitigate toxin absorption among informal sector workers with a mobile health app. These are my group mates. I am Digant, and I have with me is Lincoln, Diana, Shu Jing, Jovan, and Reyhan. Okay, this is a table of contents that will be covering through our whole app. Now I'll pass over the time to Jovan.
As an introduction to our project, we thought about the current rapid adoption of technology in society. And with that, we raised a few questions. What happens when there are news anymore? And what effects can it bring? And with this realization and further research, we believe that the SDG 3 on good health and well-being will be suitable for our project's target problem. And then we set our sights on the Philippines, where e-waste management has long been disregarded by its government and are populated with informal workers who dismantle e-waste without proper training or education, which causes major serious health risks. So for some background information, we need to understand the current toxic impact of e-waste. The rapid adoption of technology and constant innovation causes constant upgrading and high device disposal rates. In just 2022, globally, there were 62 million tons of e-waste generated everywhere, and only 32.3% of this e-waste is properly recycled. Those who are improperly disposed release hazardous substances into the environment. What are these substances? These substances include lead, mercury, cadmium, arsenic, nickel, brominated flame retardants, and many more. These materials are dangerous when dismantled or burned as they release onto the environment. And informally recycling these will expose workers to these chemicals, whether it's through air, soil, or water contamination, which causes serious health risks that include neurological disorders, kidney or liver damage, respiratory illnesses, reproductive issues, and many more. On a global scope, countries and organizations like the EU, Japan, and South Korea have already enforced strict e-waste recycling systems. These policies focus on the responsibility of the producers and proper management of toxic materials. Strong awareness and regulation by the government help reduce exposure risks. On a narrower scope, Manila specifically, Manila generates high levels of e-waste due to quick urbanization and tech use. However, most of these wastes are processed informally by the people through burning and dismantling them, which are sold to scrap workers. These toxins contaminate nearby communities such as Tondo and Payatas. Laws exist within Manila or the Philippines, however, enforcement facilities by the government remain limited. Now on to existing acts.
Thank you, Jovan. Now let's look at the existing policies in the Philippines. First, RA 6969 controls hazardous chemicals. It mostly focuses on formal facilities, not the informal workers dismantling electronics without safety equipment. Next is the Ecological Solid Waste Management Act. It focuses on general waste segregation and disposal but does not adequately cover e-waste. As a result, toxic electronic waste still ends up being improperly discarded and handled. Followed by the Extended Producer Responsibility Law, it assigns companies responsibility for managing plastic waste. However, it completely ignores e-waste, which leaves informal workers exposed to toxic materials without proper support or systems in place. Finally, an e-waste management act has been proposed, but still hasn't been effectively implemented. Without regulation, informal workers remain exposed to toxic waste with little to no protection. Despite existing policies, informal e-waste workers in Manila remain highly vulnerable to toxic exposure due to unsafe dismantling practices and limited health awareness. Hence, we decided to work on this issue as the core focus of our project.
Now I'll be doing the area of focus. So our area of focus is centered on promoting good health and well-being, which is aligned with the Sustainable Development Goal 3, which is the SDG 3. Through our project, we aim to use technology, specifically a mobile application, to help protect individuals who are exposed to e-waste toxins. The app is designed to raise awareness, detect potential toxic exposure, and provide safety information to workers and communities involved in e-waste handling. So by doing this, we not only help to reduce health risks, but also encourage safer and more responsible practices in managing the electronic waste. Okay, so on the solution, to address the health risks caused by e-waste toxicity, our team has created a Bentox short of Bente Toxics. It's a digital platform designed to protect and empower e-waste workers by improving safety, awareness, and healthcare accessibility. Bentox operates through two systems, a mobile app for workers and a web platform for doctors, working together to create a connected and safer environment. So our goal is aligned with SDG 3, which is good health and well-being, because it's ensuring healthy lives and promoting well-being for everyone. Next is about our Workers app. So basically, the Workers app focuses on the safety and awareness. It helps users identify materials inside the e-waste, detect hazardous substances, and learn about toxicity prevention and symptoms. The app can also track users' health condition, offering self-care advice or early warnings to prevent serious harms. Next one, I'll go into the Pentox Health and Emergency. So basically, for this part is for the medical support. Pentox integrates teleconsultation, which is allowing workers to consult doctors remotely. So let's say if the medicine is prescribed, it can be delivered straight to the location, because this app also includes a GPS-based clinic locator, appointment booking, and an emergency button, which is ensuring quick access to medical help when it's most needed for the users. Next one, I'll go into the Bentox Doctor Web. So the Bentox Web platform is designed for medical professionals. It gives doctors access to real-time data and then patient records and communication tools to manage care efficiently. With this dashboard and teleconsultation system, doctor can respond faster and monitor worker health trends, which is making occupational healthcare proactive and connected within the users and the doctors. So overall, Pentox creates a bridge between technology, health, and humanity. It not only protects the workers, but also builds a stronger connection between the healthcare professionals and the communities. So by promoting the awareness, safety, and medical access, Pentox also directly contribute to the SDG 3, which is ensuring a healthier and more sustainable future for everyone. So next one will be the stakeholder, will be explained by my colleague, which is Jovan.
Thank you, Lincoln. Now for stakeholders who are involved in our project, directly or indirectly. First of all, we have the project managers who oversee app development over project progress, while also managing diverse stakeholders with different interests. Next, we have the main target audience of our app, which are the informal workers who are the most vulnerable to health risks from improper e-waste handling. However, it may be difficult for them to adopt our app due to the digital divide in the Philippines and also the unsupportive infrastructure by the government. Next, we have the recycling nonprofit organizations who share the same goals as us, which is to mitigate any health environmental risks by from improper waste dismantling, which is why collaboration would be key because it would improve our project visibility for our end goal. However, they may be reluctant to do so because they have to fund their own operations and projects. Next, we have the most vital part of our app, which are the emergency help and doctors and health organizations, as they will provide a medical diagnosis and advise our symptoms of heavy metal poisoning while also acting as directory and emergency contact within the app. However, it may be difficult to find some of them because it will increase their workload and require them to have constant availability for our users. Finally, we have the scrap workers who act as a market for the informal workers, and which is why collaboration with them is the key because building trust with them will also incentivize informal workers to use our app. However, they may resist to do so because of the possible loss of income if they work with us. Next, we have the secondary stakeholders who play an indirect role in this project. First of all, we have the government who can indirectly influence our project by the policy implementation, infrastructure information, and providing funding, which is why collaboration with them is key because not only can they provide funding, but they can also provide legitimacy and increase our trust with the general public. However, they may be reluctant to do so because of potential corruption and risk of insufficient support in infrastructure, manpower, and financial resources. Next, we have the general public who act as the brand image of our app, which is why collaboration with them is key because higher trust by the general public will lead to a quicker adoption of the app. However, to do so, we need to provide proper transparency and relief of any issues of data privacy and misuse of personal information. Finally, we have the electronic companies who play a major contribution to e-waste generation and management. However, they still want to have a positive public image, which is why it would be beneficial for both parties to collaborate with each other because not only they will enable shared responsibility, but it will also strengthen funding opportunities for us in the future. However, they may still be reluctant to do so because of the absence of a proper RSA in the Philippines and their unwillingness to provide any funding to our project. That's all for stakeholders. On to Diana.
Thank you, Jovan. Next, I will be covering the limitations of our solution. While e-waste workers are a great help in reducing e-waste, their work is unregistered, which means collecting e-waste related data will be more difficult. We also found out that many of these workers don't consider health as their first priority. They often choose to dismantle with no safety procedures, since it gives more efficiency to their work, which leads to getting more profit. Another problem is the lack of constant health monitoring on informal workers. This limited data makes researchers cannot establish clear causal links between e-waste exposures and specific illness. All these factors can contribute to the low participation in preventive and medical programs. Next, we have limited resources and logistical capacity for large-scale initiatives. We also face the fact that the current regulations are poorly enforced, which leads to minimal protection. Then we also have technological barriers. Low internet connectivity and limited access to digital tools may restrict the reach of tech-based solutions. Lastly, e-waste practices vary by region, so the findings from Manila may not apply elsewhere. There are also application and infrastructure challenges in the Philippines. There's a significant digital divide and lack of supporting infrastructure. And since our services relies on GPS, internet, and mobile data, it may be ineffective in areas with poor services. We have also considered the fact that there are various types of mobile devices, and our app aims to be compatible with a wide range of it, including older models. To deal with these limitations, we can collaborate with government and United Nations for funding and infrastructure development. Despite that, this project is a significant step toward bringing health and environmental gaps. For our long-term goal, we aim to achieve greater inclusivity and long-term sustainability. Next, we created several persona and storyboard to gain deeper understanding of our users. First, we have a persona for informal e-waste workers. Jane Doe is a 42-year-old woman who is married and has 3 children. She has been dismantling e-waste for 21.5 years, but now she began to realize that her and her family's health has been declining because of her work. She needs to continue dismantling to gain income, but she needs a way to improve her health. She is struggling since she doesn't have the ease of economy or time to obtain proper training. Here is the picture of Jane Doe's empathy map. Here is the scenario we made for Jane. Before knowing Bentox, Jane dismantles electronic waste without knowing how to dismantle it properly and safely. As a result, her skin is in a bad condition and she developed a respiratory illness. After knowing Bentox, Jane can identify hazardous components and handle them thanks to Bentox sensor feature and step-by-step instructions. Bentox also gives advice on how to deal with those symptoms, so it can help informal workers that have already got health issues from e-waste dismantling. Moreover, Bentox has the feature to identify symptoms caused by the exposure of common materials that can be found in e-waste. Now, Jane knows her body condition and can treat it before it gets worse. Next is the persona we made for the government representative. Rafael Atila is the secretary of the Department of Environment and Natural Resources, which manages e-waste in the Philippines. He is frustrated because there are a lot of informal workers in the Philippines that do not follow the given procedures, leading to a negative impact to the environment and public health. Here is the scenario we made for Rotila. Rotila believes that electronic waste is not only a problem that needs to be addressed, but also a financial resource, as it contains valuable materials. However, he struggles with many informal workers who do not follow safety measures, which leads to the release of hazardous substances into the environment. As a result, several health issues has emerged, making e-waste a significant threat to public health. With the help of Bentox, informal e-waste workers learn how to dismantle electronic waste safely, minimizing the release of harmful materials into the environment. Next, I will explain about our data gathering process. We decided to gather data through a survey. There are 3 sections in it: demographic questions, work environment and health awareness, and app-related questions. After giving out the survey, we learned that informal workers in the Philippines vary from age 25 to 60 years old. We can also see that most of the workers have been in this field for 5 to 10 years. We can also see that most workers dismantle e-waste on a daily basis. They are not aware of the toxic substances in e-waste and do not use any proper equipment. Here is the image of the response to the challenges they usually face at work. That most worker wants an electronic component detailer and safety reminders function on our app. We can also see that most worker wants a search for nearest clinic and teleconsultation feature. Lastly, we discovered that these workers are willing to learn and use a new app to improve their health and safety. Next, I will be passing to Digant.
Thank you, Diana. I will now present to you the lo-fi of our app and the idea behind each page. First up is the login page. It serves as a main gateway to access the app, as well as is designed to be simple and user-friendly. Upon which, when a new user registers, they'll have to key in the important information related to them. Moving on, we have the medicine reminder. The medicine reminder serves as a function to help users manage their medication schedules. We have prioritized having persistent footers underneath to allow users a main form of navigation through the app. As for the settings, it is used to allow users to configure the app so it is suitable for the individual needs. About and support page. It's a short interface where users will get a brief information of the app as well as our background on the brand as well as the following necessary support needed whenever they face a bug or issues. Next, we have the notification. It serves as a critical alert system, which alerts them on the toxicity, as well as informing them on the safety guides and appointments they have registered for. This addresses our goal to remind users of the dangers of dismantling e-waste. Next up, we have the e-waste education. It provides a short guide for users on safety guidelines, as well as a search function to search for needed information easily throughout the numerous guidelines that have been put up. And then we have the main feature of the app, which is our Bentox lens. It is an integrated camera as well as an analysis tool. It's meant to detect and identify hazardous materials in e-waste before they are handled. It helps to prevent exposure to hazardous materials, thereby protecting them in the long term. Furthermore, we have a history function. This helps users to have easy lookup on the previously scanned item for quick references, as well as certain information that may be useful for them in the future. Next, we have another main feature, which is the teleconsult service. Its main purpose is basically to connect users directly with a doctor to discuss health concerns as well as symptoms related to e-waste. This serves as an easy and fast, convenient way to enable users to get an appointment instead of having to wait a long line physically. Next up, after a teleconsultation is done, the doctor's prescription is available in the app where users can see the medication delivery system, which includes a delivery option to help users get their medication directly sent to their doorstep. Our app also features a seamless app payment service where we don't have to fully rely on third-party payment apps. We have also included GCash and PayMaya, a commodity service that has been established in the Philippines. Furthermore, we also have a health tracking feature where users are able to retrieve their health records such as the past symptoms and doctor's notes. If users were not wanting to do online consultations or they are experiencing dangerous symptoms that require immediate attention, they can help themselves to the physical appointments at a clinic or hospital. They can choose their profiles in the Safi page, and then moving on, would be able to book at their preferred healthcare institutions or clinics. They can also provide a brief description of the symptoms. This will allow our doctors or specialists to be alerted beforehand and give a brief evaluation on what can be done upon the user's visit. Next up, we have the medical profile, where users can fully manage and edit their own profiles. In this profile setting, usually there'll be user details and then the ID, as well as previous records of their own conditions and history. We also have a key feature where they can use a QR code they have a QR code system. The app has a key feature where we can generate a profile QR code system. This provides a simple and fast way for users to give their details to any hospital or clinic that needs them. Last up, we have the emergency call system. This provides an immediate help when the user has urgent emergency matters when dismantling e-waste, especially in user cases where there may be sudden eye infection or skin irritation, as well as acute toxin exposure. It also includes a location service where services can it also has a key feature where location service is provided where users can find out the nearest clinic or hospital. This allows them to get to the immediate location for immediate action. Okay, this is our loading screen. This brings us to the sign-in page. In the sign-in page, there are certain features you can interact with. Newer users can access the sign-up page. Okay, once successfully done, they can sign in. Okay. Eventually, it comes to our dashboard, where every essential is placed within the main area. First up is our hamburger. Consists of settings, profile, and our contacts. The settings page has accessible features where the users can change according to their needs. Coming next is the profile. Users can change their profile to a medical profile to view their conditions and medications. It gives them a special QR code that allows users to access hospitals. Back to homepage. Okay, next up is the medicine reminder. Users can access the medicine reminder from days to weeks to months. In each reminder, they can see which medicine they require. Coming up to the appointments page. The users can also see the same thing for the appointments from days to weeks to months. Okay, moving on. We have the awareness post page, where users can see our automated version sliding through the page. Next, we have the e-waste education. Moving on from e-waste education, we have a hotbar, which can transform into a full menu, where users will have full access to other features of the app. First up is our e-waste camera. In this feature, users can scan and detect e-waste items that are hazardous to them. Upon taking a picture, a color will indicate what form of hazardous substance is present. Clicking once again, it brings them to the detail page. Users can access this help button, which gives them a hint on what possible indicators there are. Next, we have the history page. Users can click on one profile, which gives them a full detailed page of it. Next, we have the medical centers. Users can create appointments, as well as call or ask for directions at their hospital or clinic. Users can access the appointments by selecting their profiles or others that they require. Once they confirm, the appointment is made. If they still wish to reschedule, they can click on this. Here, they can select alternative dates and timings. And if they also wish to cancel the appointment, they can do this. Okay. Next, we have a teleconsult. This is where users will have a video call with the doctor, as well as chat with them. Once the call ends, upon pressing the details, users can buy their own medication. Last but not least, we have the hospital emergency call. Moving on from teleconsult, we have notifications. Users will be alerted on the possible toxicity as well as safety guides and appointment reminders. Should be all.
Okay, thank you, Digant. Now we are at the doctor interface. Before I start the walkthrough for low file and high file, I would like to explain why we choose browser for doctors. We think that because it supports professional workflows more effectively, doctors often work from clinics or office equipped with desktops or laptops, allowing for better visibility of patient records and multi-tab management. We decide to use the browser for doctors. And the objective is to empower healthcare professionals with a streamlined data-informed workspace by organizing essential patient information and enabling remote care. The system supports doctors in making faster, more accurate decisions for e-waste exposed communities. Okay, now we will start the walkthrough for Lo-Fi. We gave a lot of options to log in, and we can log in with Philly ID too. And if you have no account, we will go to sign up. And after that, we will go to dashboard. There we decide to put a patient list on the recent patient, and there's a button switch like we are for doctor to make it him active or non-active. If it's non-active, the doctor will not accept any patients. And there's a patient list, and doctor can decide which patient and check out the patient profile. There's like condition, allergies, it covers medications, emergency conditions, some consultation history. The doctor can filter based on the status and decide which patient to go. And let's say the doctor decides to go to this patient, there will be it will be in this format where it allows doctor to make chats, notes, medical info, orders, and history in just one page without going back to the patient profile. And now we go to the doctor profile. The doctor have to update their credential, license, and their basic information like contact information, their specialization, and their education stuff. And the settings will allow them to do some like change of email address, password. These are the basic one. And some app settings. And if they want to log out, here will be the logout here. So this is that's it for our low-fi. And now we will proceed to our hi-fi. And now we are at the hi-fi. So these are the options. Google, Apple ID is the standard one. We can log in with email and the Philly ID. Then if we don't have the account, we go to the sign up page, sign up with the email or the Philly ID, Google, Apple ID support as well. This is the Philly ID. And we will go into the dashboard, and there's a recent patient here. So the button for active and non-active, it will exist on every page. And this is the patient list, and the doctor decide to check out the patient profile. This is how we organize it. We put it in a card format, and let's say we now want to go for a consultation. This is the teleconsult page, and doctors can put notes when during the consultation, some medical info like no skin lesion, no fatigue, and some medication orders. And it will show some history of the patient, like what kind of allergies, what very short summary and mini timeline here. And the most recent consultation will have some short summary here. Yeah. And this is the doctor profile. So in every card, the doctor can edit, and they will show their license, specialization, contact information, and the education. And this comes the settings page. And to make it consistent, we've decided to put the logout here with a big red button. And each type of card settings, we will put it one save button for each. And that's all for the browser.
Thank you, Shu Jing. Now I'll move on to the conclusion part. So in conclusion, Bentox is more than just a mobile and web application, and it's a symbol of how technology and competition can work together. Through its features, Bentox empowers e-waste workers and nearby communities to stay informed, stay protected, and access healthcare more easily. Our project supports the UN SDG 3, which is good health and well-being, so by reducing the health risk from hazardous e-waste exposure and promoting safer practices. Beyond the technology, Bentox stands for social responsibility, reminding us that innovation should always serve people and the nation. Ultimately, Bentox envisions a future where workers, communities, and the environment can thrive together in safety and sustainability. I think that's all for our group project. Thank you, everyone.